A few months ago, I went to an online talk about psychedelics and their healing power. And I was really amazed at the amount of research and information there is now looking at how psychedelics are helping people to work on mental health and improve areas of stress and PTSD that talking therapy has previously not been able to touch. This is known as the era of the psychedelic renaissance because we are once again returning to research on psychedelics such as magic mushrooms, LSD, MDMA, exploring their healing benefit. From the 1970s onwards, there was a deliberate push to create a narrative around psychedelics that they are harmful. Now, what psychedelics can do is bring trauma to the surface, and if that's held in a caring and safe space, then it can be very healing. We might have all heard of people having bad trips or even seen someone having a bad trip and thought, well, if that's what psychedelics do to you, there's no way I'm touching those. Now, really, a bad trip is simply trauma coming to the surface and then it not being held. People's sense of fear of abandonment, anxiety, worry, it all then gets projected onto the surrounding environment, and if there's nothing there to make someone feel safe and held, then it escalates. But what the research is finding is that when psychedelics are used in a therapeutic setting, the method that's been used most recently in research trials is where there are two therapists and it's in a quiet, secluded, safe space. And these two therapists are holding the space and allowing the client to explore the emotions that are arising. And there's been an amazing amount of healing. People have found they've been able to meet characters from their past and make their peace with them. One person who had OCD when he started the trial, after having a particularly strong experience within his magic mushroom journey, he was able to see all the obsessive compulsive thoughts coming back after the journey. But he had a new clarity, so he was able to look at those thoughts and just think, well, why do I want to think those? They really don't help me. And he no longer registered on the OCD scale after that. Things like LSD will even help the brain to create new neural pathways and to grow connections within the brain to make it possible for the brain to become more pliable and capable of learning. So we're really standing on the cusp of an era where people who have suffered with depression, anxiety, PTSD, finding that traditional methods maybe help alleviate some of the symptoms but don't completely resolve them, that we may soon be in a situation where it would be possible to go to therapists who are working with psychedelics, or going to clinics which are specifically set up to take you through a series of healing journeys. And so this talk that I've organised is by a clinical psychologist who has a very deep understanding of these different modalities, and he can outline the benefits and the effects that they have. There'll also be time for questions, so if you have anything that you're curious about and you want to ask more details around, there'll be an opportunity to ask those questions. I think it will be a really fascinating conversation, and I hope it will be part of moving the collective understanding forward that these things that we've been told for so long are simply harmful and dangerous are a medicine. And yes, they have to be used with care. They aren't something to be used in a party setting. They aren't something to be used when we're in a space where we don't feel safe or contained, but used in an effective and a caring and conscious way, there's starting to be evidence that they can be very beneficial. So it'd be wonderful to have you there and have you as part of the conversation.